Good morning. How are you all? Hope everything goes well. Today we are talk about fracture or bone healing. You know the fracture healing or bone healing, how the bone heals. When we operate or we conserve a fracture, then its healing occur by callus. It is two types. One by healing by callus in direct union or secondary union or direct union or primary bone healing. Healing by callus or indirect union, it has 5 stages. First one is hematoma formation, second one is inflammation, then soft callus formation, hard callus formation, and followed by remodeling. And healing by direct union or primary bone healing, fracture is held by metal implant. There is no stimulus of callus. There is two processes, contact healing and one is gap healing. Now come to indirect or secondary bone healing. First one is hematoma formation. When there is a tissue damage, bleeding at the fracture site occur, the bone ends die back for a few millimeter only. Then second stage is inflammation. Inflammatory cell appears within the hematoma within usually 8 to 10 hours. Then osteoclast. Osteoclasts are formed to remove the necrotic end of the bone, which form in the hematoma stage. Then soft callus formation. After 2 to 3 weeks, soft callus formed. Fracture fragments no longer moves freely, which we called stickiness of the fracture site. The cells from a cup of woven bone periostally around the periostem or around the fracture site. The fracture can now still angulated, but is stable in length. It means we can bend the fracture, but it remains stable in length when you give physiological pressure. Now hard callus formation. When the fracture end are linked together, the hard callus start to form and last until the fragment are firmly united. Usually it takes 3 to 4 months. The bone callus form at the periphery of the fracture site and progressively moves centrally. You think this is a fracture, this is a fracture, then one is end this and another end is this, proximal end and distal end. Then callus from distal or from proximal end to the fracture end centrally. This is the central end. From proximally or from distally they come to centrally. Thus the hard callus is formed. Then remodeling. The woven bone is slowly replaced by laminar bone. This process lasts a few months to several years. This is the stage of fracture healing. This is the hematoma formation. This is the inflammation. This is soft callus. In soft callus stage, we can angulate the bone, but it is stable in length. This is the hard callus. Usually, it takes 3 to 4 months to appear the hard callus, and this is the remodeling phase. Remodeling phase, it's remain few months to few years. Now come to direct or primary bone healing. Primary bone healing has two processes. In case of primary bone healing, there is no gap in the fracture site. We don't accept any gap in the fracture site. We we put together the bony end by metal implant, usually by plate screws or by some cancellous or cannulated screws. It has two processes, contact healing and another is gap healing. Contact healing means the fracture ends are in contact. There is a less than 20 micrometer gap within the fracture site, and osteogenesis produces here directly laminar bone, not woven bone. In secondary bone healing or indirect union, here at first produce woven bone followed by laminar bone, but in case of primary bone healing, directly they from laminar bone. And in case of gap healing, gap in between fracture end are invaded by new capillaries and osteoprogenitor growing from the edge. Wider gap filled by woven bone which is remodeled to laminar bone. Here woven bone is formed followed by laminar bone. The bone remodeling unit act by removing dead and damaged bone followed by refilling by osteoblast. Osteoblast are the bone forming cell and osteoclast are the bone engulfing cell. Now come to callus. Sometime callus this come in short note in written as well as examiner may ask in viva board also. Now come to definition of callus. Immature woven bone is called callus. It's nothing, just a immature woven bone. Two types of callus. One is soft callus which is unossified and another is hard callus which is ossified. Now function of callus is it bridges the fracture site. It acts as a bridge. The fracture site scaffold for union and ossification and splinters the fracture site. Now clinical sign of healing. Load on the fracture site produce no movement or pain. The fracture site is not as strong as bone around. It means when you give a physiological load, it remains stable. And the radiological sign we get in X-ray, the callus around the fracture can be seen to pass from one broken end to the another broken end, or which is around the gap or around the fracture site. The fracture around the medulla of the bone will still visible. Now sometimes when it's come in short note, just write down the definition, type, function and clinical and radiological signs of healing. Now come to non-union definition. This is very important. Sometimes examiner may ask in viva board, also short note may become in written exam. Now come to definition. The fracture that has not healed 9 months post operation and there is a no visible progressive sign of healing in the last 3 months. This is called non-union. 9 months has lapsed from surgery and there is a no healing, no progressive sign of healing. The sign of healing at the callus, it's a sign of healing. There is a no progressive sign of healing in the last 3 months. This is called non-union. It are 3 types. One is atrophic, hypertrophic and infected. What may be the causes? Some local cause and some systemic causes. Local causes are infection to the bone, inadequate blood supply, interposition of the soft tissue between the bony fragment, excessive shearing force between the bony fragment, destruction of the bone by tumor. And systemic cause is old age, immunosuppression, maybe due to diabetes or patient is taking either steroid or some immunosuppressive or anti-cancer drugs, nutrition deficiency, osteoporosis, osteomalacia. These are the systemic causes of non-union. Now clinical features. There is a persistent pain at the fracture site. After 9 months, patient will complain the pain at the fracture site, or there is some little bit movement at the fracture site. This is called abnormal movement and clicking at the fracture, at the level of the fracture. Now radiological sign, in X-ray we get a lucent line is still present between the bony fragment. Between the two fragments there is a lucent line. The fracture has not unite yet. That's why we get a lucent line at the fracture end. Sometimes there is a exuberant callus formation trying to, but they fail to breach the fracture site. Exuberant callus means there is a lots of callus, but they fail to breach the fracture gap. This is called the exuberant callus, or sometimes no callus at all. In hypertrophic non-union we get exuberant callus, and in atrophic non-union we get nothing. We get a little bit callus formation. Okay. Now this is the treatment of non-union. Uninfected or non-infected non-union, this is hypertrophic and atrophic or non-hypertrophic. We do investigation, then we, in atrophic type we reducible non-union sites, no bone gap, secure the fixation. If there is a bone gap, secure fixation followed by bone graft, either autograft or allograft. If the gap is less, then you can take the bone graft. Usually we take bone graft from iliac crest, and when the gap is large, then we take autograft as well as allograft. We usually allograft find we have a bone bank in shower from where we give requisition for allograft how much unit we need, then they send the allograft to us. Okay. This is all about non-union. Sometimes this may come in written exam as a short note. Just write down the definition, types, causes and clinical features, radiological features and treatment. Just a brief. Now, delayed union. Just know the definition of delayed union. The fracture healing is not taking place at the expected rate and time, but healing is still possible. Usually, we give the deadline usually 6 months for delayed union. In within 6 months, there is a just little bit callus may form, and we expect the more callus will form. If it's past the 9 months, then we may call it non-union. Okay. Thank you everyone for the patient sharing. I think this lecture will help you in your written and in your Viva exam. Just read this and memorize this. Don't worry. Take care.